Dear friends, before a child is born, you prepare everything for the child. You start getting dresses, you start getting the home ready, you start getting the beds. But have you ever thought you should get ready for breastfeeding mentally and physically? If you are mentally prepared and confident before delivery, things will go very smoothly. The best that you can give the baby soon after birth is your milk. Don't think of an alternative. This breast milk, why is it the best? God has created it in such a way that it suits a baby in all ways. The baby is able to digest well, the proportion of the protein, sugar, everything is as required by the baby for its growth. It's clean, it has antibodies, it protects against the infections, and it makes the baby pass motion freely. The baby is very contented, happy emotionally, and it does a lot of good things for the mother as well. It makes her uterus shrink faster, the bleeding is less, she is also emotionally very happy, and it doesn't cost her much, doesn't involve much work. You don't have to wash any vessel, prepare and then feed the baby. You don't have to be worried that whether it is clean or not. It is 100% clean, and it is available readily anytime, anywhere. And so that is the best for your baby. But some difficulties, especially mothers who are alone, who don't have much of a family support, they may be under a lot of tension, may find it a little difficult. Breastfeeding is something which should happen naturally to anybody. As soon as a calf is born, it sucks on the mother cow. So like that, any human being who as soon as it's born, the mother should know and the baby should know it should suck. But as human beings, since we try to learn everything and then make things better, I think we should also learn the techniques and then do it better. In this video presentation, Mrs. Vidya will tell you about the positions that you take during feeding. These are the positions are generally demonstrated, but if any particular position is convenient to you, you can definitely adopt. You should not go towards the baby, but the baby should be brought towards you. That's the most important thing. If you bend forward, you start getting back pain. Okay. That is most important about the position. You can use different position for different breasts. For the same breast, different times, you can use different positions. And by trial and error, you will find out what you like and what your baby likes, and then you can start using those positions. And then when should you start feeding? As soon as the baby is born, soon after delivery. And how long to feed? Each breast for about 15 to 20 minutes initially. So totally it may take 30 to 40 minutes of breastfeeding in one sitting. You may have to feed 6 to 8 times a day initially. As the baby grows older, it may suck more vigorously, take more feeds, will be able to retain for about 3 to 4 hours, then maybe a little more, less frequently. And how do you know whether your baby is getting enough? If the baby passes 6 to 8 times urine, sucks at the breast 6 to 8 times for about 20 to 30 minutes, and then feels contented, doesn't cry unnecessarily, sleeps well, gains weight normally, passes motion normally, you really don't have to worry. It is getting enough milk. There is no way of measuring the quantity that has gone in. Another way to find out is like before giving the milk, your breast will be hard. Then after it is emptied, it will be supple and soft. That is one way of identifying that your breast is empty. And both the breasts have to be given at a time. One breast first and then the other breast. But at a time, the breast should be given at least for 15-20 minutes. During the initial part of the feeding, the baby gets what is called as a foremilk. Okay. The areola portion has a stored milk called foremilk, and the portion behind has a milk called hind milk, which is a thicker one. If the baby keeps changing the breast every 5 minutes, it may be taking only the foremilk, which contains less nutrients, and as a result may not grow well. It may not put on weight properly. So always empty one breast. Let the foremilk and the hind milk go into the baby's body, and then you change over to the other breast. Once that breast is empty, baby will automatically remove its mouth from the nipple and then look for the other breast. Most of the times during pregnancy, before the delivery, we don't give medications to improve the breast milk secretion. You should be mentally prepared and confident that you will be able to feed the child. After delivery, the first 2 days, the milk secretion will be less, but that less milk also will have a good concentrated amount of energy. That milk is called the colostrum. The baby, again, first 2 days, it may not suck very frequently, but you have to make the baby feed at least every 2 to 3 hours, and it may not pass urine. As I said earlier, normally it should pass about 6 to 8 times. The first 2 days, it may not pass more than once or twice. So the first 2 days, the things are slightly different. There is a little less secretion, the baby takes less and passes urine less. But after the 3rd day, depending upon the demand, the supply will improve and there will be sufficient milk, and the baby will be passing urine frequently and will take more milk at a time. In this video presentation, Mrs. Vidya will tell you about the positions that you take during feeding.
Breastfeeding is one of the best gifts a mother can give her child. Breastfeeding is made very simple with certain simple tricks and tips that I shall now discuss with you. Every mother can breastfeed. We have been breastfeeding since so many years, ages. A simple research shows that India is the leader in breastfeeding. So all of us women, let's take it and make it a point that we are going to breastfeed our child as much as possible. Working women, housewives, anybody can breastfeed. Initially, all of us will have a lot of questions about breastfeeding. When to start? How long to feed? How often to feed? How much to feed? Is the baby getting enough milk? Are we able to produce enough milk? I will try to explain as much as possible one by one. When to start feeding? As soon as the baby is born, if the baby is alert, you can immediately put the baby to the breast. The baby knows one thing as soon as the baby is born, that is to suck. And if the baby is given the right position to hold on, then the baby sucks efficiently. The holding on of the baby to the breast is called latching. How do we get a good latch? When you are going to offer milk to the baby, take the baby as close as possible to you and take the nipple or the breast and wipe the nipple around the baby's mouth. So the baby is very eager to have milk and it opens its mouth wide instead of just. So when the mouth is open, you can immediately push the areola and the nipple into the baby's mouth. This may take a few tries. Just keep trying. You will need help and some moral support initially, but yes, once the baby knows how to latch on, the baby will suck properly. How often to feed a child? As much as the baby wants. Initially, the milk secretion will be less. Less means just a few drops. The color of the milk is yellow. This initial secretion is called colostrum. You must let the baby have as much colostrum as possible. Keep giving. How often is the next question that comes to our mind. We can try to organize or regularize the baby to a feed of once in 1.5 hours for the first week. So if the baby feeds regularly and often, then more milk is formed, and within 3 to 4 days a good supply is collected. Then the baby can be fed less and less often. That the mother and the child can come to a understanding between themselves. The next question that comes to our mind is my baby sucking properly? One of the best ways to judge whether the baby is sucking properly is the mother's pain, the feel of the mother. In case the mother has some light pain in her breast or the nipples when the baby is sucking, that means the baby has not latched on properly. For example, let me say the baby opens the mouth little bit and just holds the nipple and sucks. There will be some milk coming out, but that is not enough milk. The milk is collected in the black area of the breast called the areola. So the baby has to suck the areola of the breast. Only then the flow is obtained, and the nipple, which is nothing but a tube for the milk to flow out, it comes through the nipple. Once the latch is formed, the hold is firm. Then you won't feel that the baby is biting you or you have a pain. Another indication that the baby has not latched on or is not feeding properly is that the baby takes a long time to feed. If the baby feeds for 20 to 30 minutes in the initial 1 week, that is good. It's not too long a time. But if the baby takes 1 hour or more and wants to feed once in half an hour after the baby has just fed and is constantly upset or crying, that means the baby is hungry, has not got a good feed. One of the ways we can help solve this problem of holding on is getting a good position between the mother and the baby. There are 4 basic positions. Anybody can take any position among these or come to their own position. These are based on observations and conveniences. Before you start feeding the baby, make sure that the baby and you are in a comfortable position, because you may have to sit for at least 30 minutes, just sit in one place for 30 minutes. So if you are hungry, grab a little snack and sit quiet for some time. And that is the time when you bond with your baby without anybody to come in between you and the baby. If necessary, you can take a small stool like I have done, because I am short and my feet don't reach the ground. So I may have some problem with my feet. It might start hurting after 15 minutes. So I have kept a stool for myself so that I am comfortable. And also make sure that your back is straight and you are relaxed. Sometimes to help the baby get a better hold, we may have to use a pillow to prop the baby. It is not necessary to have a pillow, you may need it. So the first hold is the cradle hold. Just like we are cradling the baby, we use the left hand for the left breast. Left hand for the left breast. So the baby's neck is supported by the elbow of the mother. Palm is holding the body of the baby. With the other hand, you can control the breast or the baby's nose. You can help it to breathe, or you can play with your baby, wake him up. Sometimes the baby tends to just hold the breast and go off to sleep or be happy. But no, we need to actively feed the baby for 30 minutes. So you need to be playing with the baby, wake him up, tickle the lower part of the feet, or just shake the baby. So for that, you can use your free arm. The next position is the cross cradle hold. So just as I have used the word cradle, it's the cross cradle. So the right hand for the left breast. I will support the baby's neck with my right palm. and the baby is automatically supported by the hand of the mother. So now I have the left hand free to control my breast. Sometimes the milk gets collected inside the breast and tends to form lumps. This way we can help to release the lumps. Just press on the lumps while the baby is feeding so that the milk flows out freely from the lumps. The next position is the football hold, which is a very cute little hold. The baby would love to play this hold because it can play as much as it wants. The baby is to the side of the mother. And why we call it a football hold? If you have seen a football game, the players hold the football to their side like this. So similarly, we have the baby also held like a football, and we offer the breast to the baby. You are free this way. Again, we have one hand to control the baby and the breast, or you may want to just read a book or something after the baby is grown up and you are comfortable. You are just free to sit and relax and position yourself. This also helps those who have had a cesarean delivery and the pain is still persisting. So the baby's weight is to the side and not on the abdomen. If you have a good prop and a good set of pillows, maybe 2-3 you can use, so the complete weight is supported by the pillows. Make sure you are able to sit through for at least 20 to 30 minutes at one breast. This is the football hold. Another position is the lying down position. Initially, when patients have had a cesarean delivery or they have had stitches, they may not want to get up and sometimes cannot get up for 1 or 2 days. So that time the baby can again be positioned on the pillow and the mother can just turn a little and offer her breast while she is lying down. Again, try to just support the neck of the baby. It is important that you do not hold the baby's head, because then the baby cannot move. If someone holds your head like this, you will not be able to turn around. But if the neck is supported, the head has easy movement. So we will try to hold only the neck and support only the neck. Then another cute little hold which I really like is the saddle hold. Some babies are big and are difficult to be supported. So that time they can sit, they can be made to sit across one leg like a saddle. It's a saddle hold, like you have baby carriers, like that they can be made to sit. Or when you're going on drives, long drives, or you're sitting down somewhere, you're not able to lie down or get a pillow, you can make the baby sit like this and offer your breast. This way, the mother tends to look at the baby and play with the baby also while the baby is playing. If the baby has a light cold and has a runny nose or a sore throat, this position works very well for that baby because the baby can breathe easily as sitting down. After the baby has been fed, there is something very important that you have to do. It is as important as feeding the baby, and that is burping the baby. I have just taken the baby, put it into a vertical position. I make sure that the baby's nose is free to breathe, and I slowly pat the baby's back. Slowly but firmly. Sometimes it takes 2 to 3 minutes for the baby to actually let out the air that has collected in the baby's stomach. This helps relieve the baby, and it is not enough that if you just pat the baby once or twice or just let the baby relax. You need to let out, belch the baby. It is very important. Sometimes it may not be easy to have the baby in this position. You may be afraid to hold the baby like this. So there is another simple position. You lay down the baby and just raise the baby's head and back. Put the baby across and tap the baby's back like this while you are talking to the baby. Yes, 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 go on, do it. You can be a little firm with the baby at this time so that all the gases come out, are expelled out. Another way to burp a baby, which is like more than a month old or you are comfortable with handling the baby, is to make the baby sit across one of your feet and while supporting the neck, rock the baby a little. Do not rock it too hard, baby may not like it, but across, just, ooh la la, you like it? Yes, we like that. That way. When you are removing the baby from your breast, there is going to be one thing that you are going to think of. Ouch, my baby is biting. Oh my god, the baby has a tight hold. How do I make the baby let go? The baby has slept off and it is still latching on very well to my breast. How shall I remove? It's going to be painful. So there's a simple technique for that. Take your little finger and put it between your teeth. Try to press. Are you able to close your mouth? No. Similarly, push your little finger into the baby's mouth. You are the mother, you will not hurt the baby. So push it a little firmly. The baby will hold on to your finger and let go of your breast. And then slowly take the baby away from you and lightly burp the baby. Be confident, everyone has breastfed. You can also do it. Enjoy your motherhood. All the best.